It's like nothing that I ever imagined we would go through. It's our entire 24-bed ICU has been converted into a COVID unit.
Nurses say the numbers have gone higher than they ever expected. We've heard from healthcare workers before who say after a year and a half of the pandemic, many are struggling with burnout from treating a seemingly endless line of COVID patients. But tonight, a nurse with almost 2 decades of experience is telling us why the situation in our hospitals right now is unlike anything she's ever seen. And as K2's Kelly Azer reports, we could be without the nurses and doctors we need.
It's as bad as it's ever been.
I can tell you that even a month ago, I was not thinking, or maybe 6 weeks ago, I was not thinking it would ever get this bad.
Sarah Collins is an ICU nurse at PeaceHealth Southwest Medical Center. She's been a nurse for 16 years. And while the year itself has been different than any other, she says they are facing a concerning crisis.
It seems that every week we're losing more core staff.
All across the country, hospitals are reporting many healthcare workers are leaving the profession they have trained years for and got into because of their passion.
Honestly, we're losing colleagues left and right. Right now, we have a high level of traveling nurses that get paid quite a bit of money to come and help.
With less staff,
I find it hard to even explain how alarming that is and the anxiety that it brings.
Collins says it could affect care.
We're usually a well-oiled team. We know our roles. We know who we can depend on. When you have several patients in a code situation all at once, you need to know who you're going to turn to for help.
PeaceHealth says they are below the national average of 13% turnover, though they say they have seen an uptick in July and August of employees leaving, which they say contributes to a number of different factors. In Vancouver, Kelly Azer, K2 News.
Tonight, we also heard from PeaceHealth, who acknowledges the difficult years, saying they've offered nurses support during the pandemic, including expanded sick time, raises, counseling, and more. And they quote, "No single action will ever convey our respect for how PeaceHealth caregivers continue to show up day after day, month after month, giving their all for those who need it most."
Yeah, Steve, Reynolds High School will transition to CDL for at least a week. Same with John Wetton Elementary over in Gladstone. In both of these situations, just one positive case led to the transition online.
Vaccines, masks, social distancing.
Every layer helps keep students in class.
It's all supposed to help keep kids in the classroom, but it doesn't seem to be working for some districts. All 2,600 Reynolds high schoolers will now be learning from home next week.
We sent out information to parents, and the information is very thorough.
According to school data, there's only one case at the high school, but that one person came into close enough contact with roughly 270 others, forcing them all to quarantine. It's too much for educators to teach hundreds of kids online and hundreds of others in person, so the whole school is moving to CDL.
We are confident that if our schools implement the new Ready Schools Safe Learners protocols as designed, we can achieve the delicate balance of promoting the safety of students and staff while minimizing their risk of catching the virus in school and bringing it home.
Dr. Dean Seidlinger, the state epidemiologist, says these transitions to short-term distance learning are expected as community spread is currently high. But Reynolds is trying to find other ways to reduce the number of people who need to quarantine in the future. According to the Ready Schools Safe Learners framework, if students come into close contact with a COVID-positive person, but they're fully vaccinated and don't have symptoms, they won't need to quarantine.
Well, Reynolds school staff will now be asking parents to share their kids' vaccination status. It is voluntary, but they say that information can help them reduce the need for these mass quarantines like the one they're dealing with right now.
Multnomah County is getting $1.2 million to keep its vaccine incentive program running a few more weeks. The Department of Health offers $100 gift cards for first doses of Pfizer or Moderna, $50 for second doses, or $150 for the one dose Johnson & Johnson. Officials say the program has been going well. They've seen an increase in vaccinations, though acknowledge the seriousness of the Delta variant and vaccine mandates have also played a role. The county also showed a couple of graphs that it says proves the incentive program is getting members of the BIPOC community vaccinated.
What those two graphs tell us is that this is helping us close those gaps moving forward. As I said, We know that there's a combination of factors that are influencing people's decisions, but we know that this is definitely helping.
The county is reallocating $1.2 million from the CARES Act funding to keep the incentive program going through October. The county has also asked the state for enough money to keep it going through the end of the year. This is new at 4. Some Portland Community College students are getting a leg up before the fall semester begins. 250 students are receiving free Dell Chromebooks. Those getting the laptops are students who have earned scholarships through the PCC Foundation. This giveaway is part of a partnership with Comcast. During today's celebration on the PCC campus, students were able to pick up their new computers. One recipient we talked to said he never expected this on top of getting a scholarship.
After the foundation scholarship, I was really happy, and with this, it's like exaggeration of my emotion.
Organizers say these laptops will play a big role in the school year, especially since many parts of the education process have gone digital because of the pandemic.